Hi, everyone, and welcome to this month's Advocacy Capacity Building Session. So, this month we're going to be talking about Medicaid and what the big, beautiful bill means for everybody, especially the individuals that we serve through our NAMI organizations and our affiliates. There's going to be a lot of changes that are going to impact some of the most vulnerable Pennsylvanians, and as you know, they typically rely on our services as an in-between, while they may or may not be on waiting lists. So joining us today, we have Joanna Rosenheim from PHAN, Pennsylvania Health Access Network, in addition to Robin Stelly. So I'm going to go ahead and turn that over to them. And I will tell you, if you have any questions, anything like that, just go ahead and pop them in the chat or Q&A, and one of the three of us will be monitoring those. And then take it away.
Awesome. Thanks so much, Nikki. Hi, everyone. My name is Joanna Rosenheim. I'm the Consumer Engagement Manager with PHAN, the Pennsylvania Health Access Network, and Robin Stelly is here with us today as well from PHAN. And we're going to be talking about a lot of the changes that are happening to healthcare programs in Pennsylvania as a result to HR 1, which is the big, beautiful bill. And we'll be talking about some action steps that we can take as a result of these changes and some ways that we can protect some of the programs that are currently in place. And we can go to the next slide. Okay, so just to give a brief overview of what's going on. So the reason why we're here today is to really talk about these new federal changes that are happening as a result of a law that was passed by Congress in July. The law includes various changes to healthcare programs generally, including the health insurance marketplace, Medicaid, and Medicare. And these changes will impact access to affordable healthcare for people all across the country and people here in Pennsylvania. The law cuts $1 trillion to healthcare programs nationally. These are the largest cuts to healthcare in history, and they will fundamentally change how people access health coverage in Pennsylvania and across the country. And so we're going to talk about some of those changes and what we can do to mitigate some of the harm. But the harm is massive, and the budget holes that we're going to have here in Pennsylvania will have huge impacts. So the law, it's officially called HR 1. That's really what I'm going to be referring it as today. But it's also often referred to as the Budget Reconciliation Bill or the One Big Beautiful Bill Act. And again, it was signed into law on July 4th. But many of the changes in the law will take effect at various points over the next few years. So it was signed into law over the summer, but not all of these changes are happening now. Some of them are happening, especially some of the changes as related to the marketplace, which I am going to discuss today. But most of these changes, at least related to Medicaid, are not going to take effect until really 2027. Next slide, please. So I know most of you here probably know what Medicaid is, but I just want to make sure that we're all starting from the same place before I talk about all these changes. So Medicaid is a healthcare program for people with limited incomes. It's often referred to as medical assistance, MA, or access. And there are a few different, basically, healthcare companies throughout the state that administer Medicaid benefits. So many people might know that they have Medicaid through the name of their healthcare company or their managed care organization. There are a lot of managed care organizations in Pennsylvania. Some examples are UPMC for You, Keystone First, Geisinger Health Plan. Sometimes it's hard to know if people have Medicaid because of all the different names that it can be referred to and the different companies that administer it. So I think it's just important to acknowledge what people might know it as. 3 million Pennsylvanians, nearly 1 in 4 people, get their health coverage through Medicaid here in Pennsylvania. There are various categories of Medicaid for people with disabilities, people in nursing homes, and people who are working and have health conditions. We're going to be talking about work requirements in a little while. These categories are not subject to the work requirements that we're going to discuss later on. So again, people in nursing homes, people with disabilities, people who are working and have health conditions that are reviewed by the state and you're in a specific category of Medicaid based on your health condition will not be subject to the work requirements that we discuss. And I'll reiterate that later on and talk about it in more detail later on as well. Next slide, please. Okay, so the largest category of Medicaid, the largest and most common category of Medicaid for adults specifically, is called Medicaid expansion. And there's 750,000 Pennsylvanian adults who are on Medicaid expansion. And most adults who have Medicaid in Pennsylvania are in this category of Medicaid. They are adults who are working, they're adults who are not working, and they're non-disabled adults. So most people, most adults in the state are going to be in this Medicaid expansion category unless they have certain disabilities, unless folks are in nursing homes or have a waiver. Next slide, please. Okay, so just to explain Medicaid expansion in a little more detail, it's really important for us to understand what Medicaid expansion is and who's on it, because this is a category of Medicaid that is specifically at risk, which I will explain again later on in more detail. But just to give some context, the Affordable Care Act, which was passed in 2010, was the law that fundamentally changed how people access healthcare in the US, and it greatly expanded the amount of people who were eligible for affordable health coverage. And prior to the passage of the Affordable Care Act, adults were generally not eligible for Medicaid at all unless they met very strict conditions, even more strict conditions than there are now. Believe it or not, it was even more strict. So really, unless you were pregnant and had very low income, or if you had children and had very low income, or if you had a disability, prior to the Affordable Care Act, if you were an adult, you were not eligible for Medicaid. So just to reiterate, able-bodied adults, so adults without a diagnosed disability, without children, were not eligible for Medicaid prior to the Affordable Care Act and prior to this Medicaid expansion category. So in 2015, Pennsylvania did expand Medicaid, which allowed adults with incomes up to 138% of the federal poverty level, so that's around $22,000 for a household of one, to qualify for Medicaid for the very first time. So this expansion of Medicaid really increased the amount of adults who were eligible for the program in Pennsylvania. And now we have 750,000 adults who are in this Medicaid expansion category who were previously not eligible. 750,000 people who just weren't eligible at all now have Medicaid because of expansion. Next slide, please. So I just have a chart here to sort of demonstrate in greater detail what Medicaid was before expansion and what it is now. So the adults who were eligible for Medicaid before Medicaid expansion were really only adults with a disability, adults with minor children and very low income, or pregnant women with very low income. And now, after Medicaid expansion, so under current law with Medicaid expansion, adults with income below that $22,000 for a household of one are eligible. So you don't need to have children, you don't need to have a disability. As long as you meet the income requirement, you are eligible for Medicaid. So it has greatly expanded the amount of people who can have coverage through Medicaid. Additionally, expanded coverage for pregnant women and increased the income limit to be eligible for Medicaid. Next slide, please. Okay. So again, I just want to be clear who is and who is not on Medicaid expansion, just because the categories are very confusing. So I mentioned this earlier, but seniors or people with disabilities who have Medicaid through a waiver are not on Medicaid expansion. Seniors living in nursing homes who have Medicaid are not on Medicaid expansion. People who have MOD, which is the Medical Assistance for Workers with Disabilities category, do not have Medicaid expansion. And then children with special health care needs who have Medicaid through a special category called PH95 are also not in this expansion category. And then children who have health coverage through CHIP, which is the Children's Health Insurance Program, are not in the expansion category. CHIP is a separate program from Medicaid and is not considered Medicaid expansion. The rules that I'm going to talk about later do not apply to these groups of people listed here. The rules I'm talking about later, as related to work requirements, only apply to people in the Medicaid expansion category. Next slide. Okay. So why is Medicaid expansion important? It's really important for us to talk about Medicaid expansion and understand the differences, because as a result of HR 1, which is the big beautiful bill, Pennsylvania will lose $20 billion in federal funding over the next 10 years. That's a lot of money, and Pennsylvania just can't make up for these budget losses. And the state is going to have to make some really difficult decisions in order to make up for the loss, which could mean cutting certain Medicaid programs. We don't know what programs the state will decide to cut, but we do have many optional programs here in Pennsylvania that are at risk. Those include, dental benefits through Medicaid, programs like MOD and PH95, programs like the Home and Community-Based Waiver Services, and Medicaid expansion. These are technically optional. The state can choose to cut them, and they're definitely at risk because of the budget losses that we're losing through federal dollars. So Medicaid expansion is really important because it's optional. The state did choose to expand Medicaid in 2015, and they can choose to take it away in order to make up for these federal funding losses. And if Medicaid expansion is eliminated, then these 750,000 Pennsylvanian adults who are in the category could lose coverage. So it's really important that we make these distinctions because we do believe that the program could be at risk. All that to say that the fight isn't over. We don't know yet what decisions the state is going to make. And we have some action steps later on that folks can take to try to fight and save Medicaid expansion. But I did just want to mention, what it is and why it's important. Next slide, please. Okay, so as a result of HR 1, and now that we've, sort of defined Medicaid expansion and understand some of the different categories of Medicaid, I'm going to talk about some of the changes that are going to happen over the next year or so as a result of HR 1. Most importantly, the new law is going to be implementing work requirements for adults ages 19 to 64 in the Medicaid expansion category. So again, this does not apply to seniors in nursing homes. It does not apply to people with disabilities on waiver programs. Only people in the Medicaid expansion category will be subject to these work requirements. Also important to note that the work requirements are not going to take effect until January 1st, 2027. So not this January, but next January. So pregnant people and people, I just want to mention too, pregnant people and people eligible or on Medicare are also not subject to the work requirement, just to note that as well. And what is the work requirement? So the new work requirement rules, they're also known as community engagement rules, again, will take effect January 1st, 2027, not this January, next January. So we have over a year until these work requirements for Medicaid take effect. I just want to make a small side note that work requirements for SNAP are already in effect as of September 1st. I won't be discussing that in detail today, but I can share more information about SNAP work requirements. I don't want folks to get confused about that because the Medicaid work requirements have not started yet, and no one is subject to those work requirements yet. In order to meet the Medicaid work requirements, Medicaid recipients or applicants must be working, doing community service, or in a work program for at least 80 hours a month, or they must be attending educational or career training programs at least half-time, or they must be engaging in a combination of these two for at least 80 hours a month, or they could have monthly income equal to at least the federal minimum wage times 80 hours. So that would be $580 a month. If someone has income that's $580 a month, they could meet the work requirement. Or if they're a seasonal worker with average income over the prior 6 months of the federal minimum wage times 80 hours, then they can meet the work requirement. So that would be $588 a month over the previous 6 months. Essentially, people have to prove that they are working in these ways or volunteering or engaging in work training programs, and they have to submit paperwork to prove that they are doing so. Let me see if any questions. Okay, next slide. All right, in order to be compliant with the work requirement, people have to have been compliant with one of the rules mentioned earlier within 1 to 3 months prior to applying. So you have to have basically been in compliance with these rules at least 1 month prior to submitting an application. We don't know exactly yet if the state's going to require it to be 1, 2, or 3 months. I also just want to mention there is a lot in general that we still don't know about how the state is going to be implementing these new rules, these new work requirements. We don't yet know a lot about what documentation they're going to be requiring. So there's still a lot more that we will be updating you all with. We really just know what the rules are at this point, and we'll have more information later on about how the state is going to prove some of these things. But what we do know right now is that people have to be compliant between 1 to 3 months prior to applying. And then at renewal, which because of the rule changes in HR 1 will be every 6 months, people have to be compliant at least 1 month between your last eligibility determination. If folks are not compliant with the work requirement, they will be terminated from Medicaid coverage. So if they cannot prove that they're compliant with these work requirements, then coverage will be terminated. And then additionally, if folks are found not compliant with the Medicaid work requirements, they will also not be eligible to purchase affordable health coverage through Pennie with tax credits. I'll discuss this a little more later on, but Pennie is our state-based marketplace that allows people who have income above that Medicaid limit to purchase health coverage with financial assistance. So it's really where folks can go to purchase affordable health coverage if they're not Medicaid eligible and can't get health coverage elsewhere. And one of the rules implemented through this law, or that will be implemented through this law, is that if folks are found not compliant with the work requirement, they will be essentially barred from being able to obtain affordable health coverage through Pennie if they aren't compliant with these work requirements. So it really is very devastating because these people will be in a coverage gap. They won't be eligible for Medicaid if they don't meet the work requirement, and they also won't be eligible for Pennie if they don't meet the work requirement. Next slide, please. Okay. So there are some exemptions from the work requirements, which I have listed here. And I just want to mention again that we don't know exactly how these exemptions are going to be confirmed by the state. We know, or we have some information about how the state is confirming certain exemptions from SNAP work requirements, but we just don't have a lot of information yet about what the state's going to do to approve these exemptions because they're still figuring it out themselves. So we will definitely have more information about what folks can do to protect themselves if they qualify for one of these exemptions, how they can prove the exemptions. More will come on that later, but I did just want to talk about what the exemptions are because we at least know that. So again, for people in the Medicaid expansion category who will be subject to the work requirements, there are some exemptions for that group of people. They include parents or guardians of a child under 14 or a person with a disability. So if someone is a parent, guardian, caregiver of a child under 14, it's very important to know under 14, not a child under 18, it's under 14. Or if they're a parent, guardian, or caregiver for a person with a disability, then they can be exempt from the work requirement. If someone is pregnant or in the 1-year Medicaid postpartum coverage period, then they're exempt. So if someone is currently pregnant or if they had a baby within the last year on Medicaid, then they're exempt from the work requirement. People who fall into this medically frail or special needs category will be exempt. Medically frail, I just want to note as well, I think there are still some things to work out on the state side to figure out who would qualify as someone who's medically frail. But based on some information that we have, it could include people who are blind or disabled. So if there's a diagnosed disability, that would fall under the medically frail category. Other individuals with physical, intellectual, or developmental disabilities, individuals with substance use or a disabling mental disorder, or those with serious or complex medical conditions. Those are some of the things that we think could qualify under this medically frail definition. But again, we're going to have to work some of this out with the state. There might be some advocacy to do around this, and so we will have more information on that. So again, people participating in a substance use treatment program, I believe they must be actively participating in a program. I don't know exactly what that means. Again, I think these are some things that we still have to work out with the state. But if they're in a program, then they can be exempt from the work requirements. Veterans with disabilities, people who are compliant with work requirements that already exist for TANF cash assistance or SNAP, people who have been incarcerated currently or within the prior 3 months, or foster youth or former foster youth under age 26 can all be exempt from work requirements if they prove that they have one of these exemptions. And again, we're going to have to work out what that proof looks like and what the state will be asking for to prove these exemptions. Next slide. Okay, so another rule that will be in effect starting January 1st, 2027 as a result of HR 1 is that adults on Medicaid expansion will be required to renew their coverage every 6 months. So currently people in this Medicaid expansion category only have to renew their coverage once a year, every 12 months. Starting January 1st, 2027, people will have to renew their coverage every 6 months. If you're familiar with the Medicaid application and renewal process, you will know that it is lengthy and people have to submit already under current rules a lot of documentation and information. And it is often, renewals are often a point where people are terminated from their coverage for what's called procedural reasons. So for not submitting certain paperwork, maybe missing one pay stub, not submitting a document that the caseworker requested, or if a document that you submitted just magically never appeared at the county office or in the caseworker's inbox, you can be terminated from coverage for what's called a procedural reason. And so when the renewal period is changed to every 6 months instead of every 12 months, it will have huge impacts because we know it's already a point where people churn off Medicaid. And we expect that to increase. And, you know, it's hard enough for people to keep up with these paperwork requirements as it is. And so requiring to do this renewal every 6 months, you know, we expect will have huge impacts. And we do expect, you know, people will lose coverage as a result of these increased paperwork requirements. Again, this 6-month renewal only applies to the Medicaid expansion population, but we do expect that everyone on Medicaid, so people on Medicaid in those other categories that I mentioned, people who have waiver, people who are in nursing homes, people who have MOD or PH95, those those other categories that are separate from Medicaid expansion, we do expect that they will also be impacted by these increased paperwork requirements because staff through the state are going to be, overburdened with paperwork, and the call centers are going to be busier, and it's just going to be harder for the state to keep up with these paperwork requirements, which will have impacts for people who are in different categories of Medicaid. So we do expect that there will be repercussions to this for everyone on Medicaid, not just the expansion population. Next slide. Okay, so I know this is a lot of bad news. I should have mentioned that up front. And yeah, we've gone over a lot of information. I'm about to go over more information, but I did just want to say that for those people who are on Medicaid, or if you're working with folks who have Medicaid, there are a few things that you can practically do to protect yourself as these changes start happening. One thing that's very important that everyone should be communicating is that folks should have updated contact information with the county assistance office. I don't have the number here, but I'll share it in the follow-up. There is a statewide call center number that folks can call to update their contact information. It'll be really important to do that because in my next recommendation, everyone should be opening all mail and Compass messages that they receive from the Department of Human Services or the County Assistance Office. It'll be more important when these changes take effect to check those messages than ever before, because there are going to be new rules that people need to meet, more paperwork that people have to submit, and folks really need to be prepared to open those messages, ask for help if they need it. Do not delay submitting things. I know this is a very overwhelming process, but folks should really be prepared to submit these things more frequently and regularly and ask for help when they need it so that they're not at risk of being terminated from coverage for one of those procedural reasons, like I mentioned, where if a pay stub isn't submitted or if the correct documentation isn't submitted, that could result in termination. And so it'll just be really important to keep up with all of this information and submit as much documentation as possible, honestly. PHAN does have a statewide helpline, so people can call us for assistance with submitting renewals. We help people submit new applications. We answer just questions in general that people have about what they might need to submit or what the status of their coverage is. So definitely encourage folks to call our helpline, and our number is listed here. I'll post it in the chat as well, but it's 877-570-3642. And then lastly, we're going to talk about this more later in more detail, but it's really important that people tell us how Medicaid is important to them so that we can fight to protect Medicaid, especially this Medicaid expansion program. And the stories are really the most impactful way we can do that. And Robin's going to discuss that in more detail later on, but I do have a link here for a way that people can record a quick video to share their story about how Medicaid is important to them. And again, we'll talk about that more a little bit later. All right, next slide. Okay, so I know the focus for a lot of you is on Medicaid, but I did just want to talk a little bit about Pennie as well, because a lot of the changes that are going to happen to healthcare as a result of HR 1 will impact the health insurance marketplace here in Pennsylvania. Our program is called Pennie, but it's a program for people who don't have Medicare, don't have Medicaid, and are not offered employer insurance. And it allows people to purchase coverage with tax credits to make their healthcare more affordable. Nearly 500,000 Pennsylvanians are currently enrolled in Pennie. This is more people now than ever before. And that is thanks to some enhanced tax credits that were passed back in 2021. I'll talk a little bit about those later on. But we really have record enrollment in Pennie thanks to affordability through these tax credits that are currently being considered under Congress. Next slide. So currently 9 out of 10 people enrolled in Pennie qualify for the tax credits that help lower costs through Pennie. Without the tax credits, the full cost of plans through Pennie would just be prohibitively expensive for most people. So most people who have Pennie coverage do qualify for some sort of tax credit to help lower premium costs. The tax credits also help people with low incomes. So people with income below around $23,000 a year qualify for free plans through Pennie for now. This might change because of some of the rules, or because of the tax credits that might not be extended. But for now, people with low incomes can get a free plan through Pennie. And many Pennsylvanians, including small business owners, preschool teachers, students, gig workers, a lot of early retirees also rely on Pennie for affordable health coverage, and will all be impacted by some of the changes that are going to occur over the next few years. Next slide, please. Okay. So just a quick overview of some of the federal changes specifically to Pennie that are going to be happening as a result of HR 1. We're not going to discuss each and every change that's going to take effect for Pennie today, but they can generally be broken down into three main categories, and they're similar to the changes that are going to be happening to Medicaid. But first of all, as a result of HR 1, there will be more barriers to the application process for Pennie for a variety of reasons that I'll discuss later on. 2, and this applies to Medicaid as well, certain immigrants are going to lose access to affordable health coverage through Pennie. More details on that later. And then 3, we do expect that premiums, so the monthly costs for Pennie plans, will significantly increase if Congress doesn't take action to extend tax credits by December 31st. Next slide. So some of the changes that are going to happen, this is a list here of some of the most important changes that are going to take effect for Pennie between January 2026 and January 2028. Again, this is not every single change that's going to happen. There are a lot of sort of small rule changes that are going to take effect for Pennie that I'm not going to discuss, in detail for all of them. But I have linked a resource here from our national partners, the Center on Budget and Policy Priorities, that includes a more detailed list of all of the changes that are going to happen to Pennie and when, so a more detailed timeline of when each change will take effect. And you can also check out our website, pahealthaccess.org, for more details on all of the Pennie changes. But just to review some of these that are listed here, which are some of the most important ones. The first one here is increased paperwork requirements. So similar to Medicaid, there will be increased paperwork requirements through Pennie. There is a small caveat, which is that there's a lawsuit pending right now that currently puts a pause on these paperwork requirements. But if the lawsuit fails and the rule takes effect, it means that, in general, Pennie applicants will have to provide more documentation to prove their income, and they'll also have to provide more documentation to prove that they're eligible for what's called a special enrollment period. The special enrollment periods allow people to apply for Pennie outside of the open enrollment period if they have special circumstances. So for Pennie coverage, you have to apply for coverage between November 1st and January 15th. That's the open enrollment period. If you want to apply for coverage outside of that window, you need to have a special circumstance called a special enrollment period, or that gives you a special enrollment period to apply for coverage. So if people have a life change, like losing health coverage through a job, or for example, losing Medicaid coverage, they can be eligible to enroll in Pennie through a special enrollment period. And right now, applicants don't have to provide proof to trigger that special enrollment period. But with the increased paperwork requirement rule, people will have to submit proof of a special enrollment period, or that they have a special enrollment period in order to apply for Pennie. So in general, just more paperwork. Folks will have to prove more in order to qualify for Pennie, and it just adds more red tape, more bureaucracy to the process, and we know that is not good for applicants, and will result in fewer people enrolling in coverage. And then, so not this year, but for plan year 2028, Pennie will no longer be allowed to automatically renew people's coverage. Right now, Pennie does automatically renew people's coverage every year. But starting in 2028, people will have to take action on their own to submit an application every year. The renewal process for Pennie is generally much easier, actually, than it is for Medicaid, which is good because it allows more people to maintain their coverage, and there isn't that churn that we see through Medicaid where people are getting cut off from their coverage for not submitting paperwork. It just doesn't work the same for Pennie. There's generally less requirements to apply and qualify for Pennie, which is a good thing. But that is going to change starting in 2028. Folks will really have to take action every year to resubmit their application. Additionally, in plan year 2027, the open enrollment period for Pennie will be shortened by 2 weeks. And then I mentioned this a little bit earlier, but when Medicaid work requirements take effect, people who are found ineligible for Medicaid because they didn't meet that work requirement will not be eligible for tax credits through Pennie. This really impacts people with incomes between 100 and 138% of the federal poverty level. So that's around $16,000 to $22,000 a year for a household of one. These people will essentially have a coverage gap because they won't be eligible for Medicaid if they don't meet the work requirement, and they will not be able to purchase a Pennie plan with tax credits if they don't meet the work requirement. Again, for a more detailed list of all of these changes, we have a resource here. There is a timeline of what's going to happen. I really think it's important that you all know about Pennie and what Pennie is and the coverage that it offers, because it is a really important program for people who have incomes just above the income limit to qualify for Medicaid. Next slide, please. All right, so I think I've mentioned the enhanced tax credits a couple of times, but just to give a brief overview, most Pennie enrollees receive financial assistance in the form of tax credits that help lower the monthly costs for Pennie plans. So there is a monthly cost for Pennie. It's called a premium that does not apply to Medicaid, but for private insurance and including insurance through Pennie, there is a monthly cost. But the tax credits really help lower that monthly cost for people, and they're immediately applied to the plan premium. So people don't have to wait until tax time to receive the credit. They are, they submit an application and the credit is directly applied to the plan premium on a monthly basis. So these tax credits are really what make Pennie plans affordable for folks. It's a government program. The tax credits are provided through the government. And in 2021, enhanced tax credits were implemented that made health coverage through Pennie and through the marketplaces nationally more affordable than ever. So there have always been tax credits through the marketplace. Again, the marketplace is sort of what it's what the program is called nationally, but here in Pennsylvania, we call it Pennie. There have always been tax credits to help keep the plans at a lower cost than what they would be full cost. But in 2021, there were more tax credits passed that really, really made the coverage a lot more affordable than ever before. And these enhanced tax credits are set to expire at the end of this year unless Congress takes action to extend them. The government is shut down right now, and one of the main reasons that it's shut down is because Congress is debating whether to extend these tax credits for the marketplace or not. So the debate is not over. There's still time for these tax credits to be extended, but we have to take action to demand that it happens. Next slide, please. Okay, so just to review the impact of the enhanced tax credits, tax credits overall have roughly doubled since the enhanced credits were passed in 2021, which cut premiums in half. So because of the enhanced tax credits, premiums have been cut in half from what they previously were prior to 2021. More people are eligible for the tax credits now than ever before. And most people enrolled in Pennie only know having coverage through Pennie with these tax credits. So folks are really going to feel the impact if and when they're notified about premium increases. If Congress does not extend the enhanced tax credits, people will receive notices saying that their premiums will double or more. And folks likely won't be able to afford that and will drop coverage. So we do expect coverage to drop, or enrollment to drop by half if the enhanced tax credits are not extended. And yeah, as you can see from the chart, enrollment in Pennie has just soared over the last few years. There's more people enrolled now than ever before because of the enhanced tax credits. Next slide. Okay, so just to give a couple of scenarios of what this actually means for people. So I'll just talk about the second scenario on the right-hand side of the screen. For a married couple, 60 years old in York County, with an annual income of $82,000 a year, with the enhanced tax credits. So right now, with the enhanced tax credits in place, their monthly premium is $586 a month. That's $7,000 a year. It's a lot of money, but much lower than what it would be without the tax credits. Without the enhanced premium tax credits, their monthly premium would be close to $3,000 a month. That's $35,000 a year, and would be 44% of their income. So this is just unattainable. I mean, it's quite frankly ridiculous. If the enhanced tax credits expire, there's just no way a family could afford paying $35,000 a year just in premium. So that doesn't include anything else that health coverage would cover. It's just the monthly costs. That would be $35,000 a year for this specific couple. The tax credits through Pennie are determined by a few different factors, including location, age, household income. And so the amount that people pay is very specific based on those circumstances. But this just gives an example of what it would be like for a 60-year-old couple, York County, with an annual income of $82,000. We will really see the monthly premiums for Pennie go up a lot if the enhanced tax credits aren't extended. Next slide. All right, so then we have some action steps for Pennie enrollees. They're going to be pretty similar to what I mentioned for Medicaid, but for Pennie specifically, it's really important to keep detailed records of income information, including tax records, bookkeeping records for people who are self-employed, or pay stubs, because you have to basically predict your income for your Pennie application every year. And so it'll be really important to make sure that that income is accurate. And additionally, Pennie might be requiring more documentation to prove income moving forward. So it'll just be really important to keep all of these records. This applies to Medicaid as well. So I think all of the recommendations I'm talking about really do apply to both Medicaid and Pennie. But specific to Pennie is that resubmitting an application every year. Folks on Medicaid do have to do this as well, but they'll have to do it every 6 months. For both Medicaid and Pennie, really important that you resubmit your applications, your renewals, every 6 months for Medicaid and every year for Pennie. Additionally, for Pennie, it'll be really important to update income regularly to avoid tax penalties. It's just really important for Pennie specifically that income is accurate so that folks don't have to owe back money on their taxes. Important to shop for plans through Pennie. So unlike Medicaid, for Pennie, people can choose between a variety of options that they can purchase from, and the costs will vary, and it'll just be really important to really think about your options and shop for plans through Pennie as these changes are occurring. Again, we have our helpline. We do help people enroll in Pennie as well as Medicaid, so folks can call our helpline. We'll post it in the chat. And similar to our ask for Medicaid, it'll also be really important to let us know why Pennie coverage is important to people. We need to have these stories, and we need, you know, people to really speak up about how a Pennie premium increase would impact them, so that we can bring those stories to members of Congress and urge them to extend the tax credits that they're currently debating. Next slide. All right, so now I'm going to shift gears a little bit to talk specifically about some immigrant rules that are changing as they relate to both Medicaid and Pennie. I do recommend, I'll share this in the resources afterward. Our partners, Community Legal Services, have a much more in-depth webinar on immigrant rules and eligibility. This is a very brief overview of the changes that are going to be happening as they relate to immigrant access. If you want a more in-depth, if you want some more in-depth information about different immigration statuses and what they mean, I recommend watching our webinar, the webinar through our partners, Community Legal Services, which I will share after this. But just to give a brief overview, HR 1 includes changes, unprecedented changes to immigrant access to health coverage that we've ever seen. Like the changes to immigrant access are devastating. People, lawfully present immigrants that have historically been eligible always for Medicaid and Pennie, will no longer be eligible for coverage. The new rules really restrict the amount of immigrants that can be eligible for Medicaid and Pennie coverage. We're just talking about lawfully present immigrants here. We're not talking about undocumented immigrants for now. Of course, there will be impacts for undocumented immigrants as well, but I'm really talking about changes to rules related to lawfully present immigrants. So starting in October 2026, so next year, immigrant access to Medicaid is going to be limited to essentially 3 groups of immigrants. Those groups include green card holders who have had their green cards for 5 or more years. So currently, people who have had a green card for less than 5 years are barred from Medicaid. That is still going to apply. You have to have a green card for 5 or more years in order to be Medicaid eligible. Cuban and Haitian entrants, so people from Cuba and Haiti, will be eligible. And then COFA migrants, which are migrants from specific Caribbean countries. CLS has said that they don't believe there are any COFA migrants in Pennsylvania. So this really doesn't apply to anyone. It's just technically a group of immigrants who would be eligible, but it really is irrelevant for Pennsylvania because we don't believe we have any COFA migrants here in Pennsylvania. So essentially, starting in October 2026, only green card holders who have had their green card for 5 or more years, or certain Cuban and Haitian entrants, those are the only groups of immigrants that will be eligible for Medicaid starting in 2026. I do want to mention, though, that these rules only apply to adults. So lawfully present children with lawfully present immigration statuses will still be Medicaid eligible if they meet the other requirements. So they still have to meet the income requirements as well, but no immigrant rules are changing as it relates to children. This is just for adults. Next slide, please. And then the rules are pretty much the same for immigrant access. Or actually, is there one slide before this? Maybe not. Okay. So I mentioned in the previous slide the groups of immigrants that will be eligible for Medicaid starting in October. It's really 2 groups of immigrants, Cuban and Haitian entrants and green card holders that have had a green card for 5 or more years. Those are the only groups that will be eligible starting in 2026. HR 1 has essentially eliminated Medicaid eligibility for many lawfully present groups of immigrants who have, like I said, historically been eligible for Medicaid. This includes a lot of humanitarian immigrants, including refugees, asylees, victims of human trafficking, certain immigrants from Afghanistan and Ukraine, hundreds of thousands of immigrants that have been eligible because they're lawfully present have been eligible for Medicaid will no longer be eligible starting in October 2026. So it really is a devastating change to the rules, and will really leave no options for these groups of immigrants to have affordable health coverage here in the United States. I also just want to mention again, these rules only apply to adults, so lawfully present children, children with lawfully present immigration statuses will still be eligible to Medicaid, and these rules are not changing for children. It's only for adults. Next slide. All right, and then the rules pretty much are the same for Pennie, except the timeline is different. So instead of this starting in October 2026, well, first I'll just mention, starting in January 2026, so in a couple months, premium tax credits that are currently available to all lawfully present immigrants with low incomes. So immigrants with income below 100% of the federal poverty level are eligible for tax credits through Pennie right now. Starting in January, those immigrants will no longer be eligible for tax credits through Pennie. So that's one change starting January 2026, and then starting in January 2027, those same three groups of immigrants that will be eligible for Medicaid, those same groups will be eligible for Pennie moving forward. So green card holders, Cuban and Haitian entrants, and then those COFA migrants who really, as far as we know, don't exist in Pennsylvania. So really green card holders and Cuban and Haitian entrants will be the only immigrants eligible for tax credits through Pennie starting in January 2027. The only difference is that technically other lawfully present immigrants could purchase a full cost plan through Pennie, but it's really just prohibitive. Like the cost would be way too much for most people, especially people with lower incomes, to afford. So it essentially bars these immigrants from being able to afford health coverage through Pennie. Next slide. So as a result of all of the changes that I mentioned, we do expect around 600,000 Pennsylvanians to lose health coverage through Medicaid and Pennie. We expect that uninsured rates will strain hospitals, particularly rural hospitals, because uncompensated care will increase. So people will be uninsured. They're still going to show up to hospitals, and hospitals are still going to be required to treat people in emergency rooms. But if they're uninsured, hospitals will basically have to pick up that cost, and it's going to be unsustainable because hospitals really won't be able to afford the cost of covering all of these uninsured folks. And so we do expect hospitals to close as a result of these changes. Additionally, we do expect more people to be at risk of medical debt. If folks lose health coverage, they're still going to need care. They're just not going to be able to really afford their care. So they will be more at risk of medical debt. We already know that a lot of Pennsylvanians currently have medical debt, and we expect that to just increase even more. And then, we expect small businesses to suffer as well as a result of these changes. Next slide. Okay, so these changes will have huge impacts. There's still a lot of work that we can do through the state to help maintain the programs that we have. The biggest thing right now we see is, fighting to keep Medicaid expansion and the Pennie tax credits. So we have a couple of links here. I'm going to pass it off to Robin in just a minute, and she's going to talk about how to share your story and some things we can do around storytelling. But I do have a couple of links here. We're asking folks to reach out to members of Congress, urging them to extend the enhanced tax credits through Pennie. And then I have a link here where people can record their story for both explaining why Medicaid is important to you and explaining why Pennie is important to you if you have health coverage through Pennie or if you know someone who has health coverage through Pennie. I'll post these links in the chat. We'll also send them the slides out afterward, and we'll send out, I think, probably a follow-up email as well with all these links. But there's still a lot of work to be done. We can fight to protect what we have, and yeah, we really appreciate all of you being here today and listening to us, and I will, I think, pass it off to Robin. I don't know. If we go to the next slide. I think that's her. Yeah. Let me just check to see if I have any questions I can address.
There was one question about the COFA immigrants, but Robin popped an answer in there. So thank you, Robin. Otherwise, it's just been, will we get the presentation? Oh, there's one right there. Or there's another one just popped in.
What legal obligations do hospitals have to treat uninsured, whether in emergencies or in less urgent circumstances? If someone comes through the emergency room, they have to be treated. You can't be denied care if you show up to an emergency room, regardless of insurance status. I'm not a legal expert on certain rules, but I do know that if you have to be treated if you show up at an emergency room, regardless of insurance. So I know that there's some, I think, as of now, regardless of immigration status as well. If it doesn't, an emergency room can't ask you for your immigration status in order to receive care. It doesn't defeat the reason for insurance just because they'll bill you. If you show up to an emergency room and you don't have insurance, you will receive a bill. So if you go to the ER, if you're in an accident, you could end up with a bill for hundreds of thousands of dollars, and they will hold you responsible for that. And it will impact your credit, your debt, your ability to rent a home, get loans. It has huge impacts if you cannot pay it for a bill that you get from a hospital. A lot of hospitals have financial assistance or charity care programs, but they're notoriously sort of hard to apply for. Not everyone qualifies for them, and there are limitations on immigration status to qualify for those financial assistance programs at certain hospitals. So yes, they have to treat you, but it doesn't mean they can't bill you. If you don't have insurance, they can still send you a bill. Any other questions? Yeah, feel free to post any other questions that come up in the chat and I can answer them as Robin speaks, but I'll pass it off to Robin.
So we talked about maybe having a break now. I don't know what you think, Nikki, about that. It's up to, we just talked about it. Yes, no?
I let's just roll with it.
Roll with it? Okay, good.
Yeah.
Okay. So I'm going to do some, I'll have some bad news and I'll have some good news too. So I apologize in advance for any of the bad news, but it's the world we live in. So I'm going to talk about storytelling. I think that storytelling is the most important thing that any organization can do right now when it comes to defending what we have. And I say that without qualification. It is the most important thing any organization can do is gather stories about people who use Medicaid or Pennie.com, but I'm going to just narrow it to Medicaid right now, but just it applies to Pennie.com as well. And I know that NAMI is really good at collecting stories, and so I applaud you for that. So thanks for doing that hard work. So next slide. So this is really important to remember as well, and this is what is really, it goes with storytelling. Storytelling does a bunch of stuff, but one thing that storytelling does is point out how connected we are. And we are connected. We're connected in infinite ways. And I'm just going to talk about healthcare. We are all connected when it comes to the healthcare market because, or I should say, so you cannot take one group of people out and expect the system to work. It won't work. You can't say, I just want to cover people who are healthy. That doesn't work. I just want to cover people who are sick. That doesn't work. I want to cut out old people. They're expensive. That doesn't work. You can kick us out for a while, but the system will collapse. And that's what we're actually seeing in America now is the collapsing of the healthcare system. That's a different talk. But always remember that whenever someone says, well, if we just got the immigrants out, or the people who are here and they're not documented, that would solve everything. It never solves anything to exclude people. It only solves problems if we bring people in. That's how healthcare works. That's how providing healthcare to a population works. Everybody must be covered. And so I always start with this because it's a really good image that if you've had time to look at it, and you do when you get the slides, you should, because it's really well done. And it just keeps reminding us that we are all connected in this. Next. So what do we know? Very quickly, to just highlight what Joanna said. Work requirement reporting is going to start January 27th, and there will be consequences for noncompliance. That starts January in 2027. Next. We know that Pennie.com is going to be harder to use. Certain immigrants are going to lose access. Certain immigrants are going to lose access to Medicaid. We know that premiums are going to be higher. That means people are going to opt out of the system. Remember, we can't afford to lose people. People are going to opt out of the system. So we know that's going to happen. What else do we know? Sorry, next. And then Joanna highlighted why these things are going to happen. So we're going to keep going. And we know this is true as well because of HR 1. Joanna mentioned the increased medical debt that people are going to face. There are going to be people who lose coverage. Joanna mentioned a number, 600,000 people because of Pennie, because of Medicaid. State and local tax revenue is going to fall, which means local governments are going to have less money. Constituents are going to have new copays. These are people who maybe aren't on Pennie, maybe not. They're going to have higher copays. Hospitals are going to close. Nursing homes are going to close. People are going to die. We know this is going to happen. We can't guarantee that all these numbers are exactly right, but they were put together by a very smart person who tends to be very careful when he does this kind of work. He takes always the middle ground number, not the most extreme number on either side. We know that the gray bar up top is going to happen. And so when you get these slides in a PDF form, you can see the statewide numbers on top, and you can look up your congressional district and see how your congressional district is going to be impacted. So this is the bad news. We can't do anything about it. It's done. This is baked in. HR 1 passed, and this is what's going to happen now because of it. And that's harsh and bad and sad, but it's done now. So we move on. And that this is the good news. We are very powerful, and we have some options of what to do now that this has happened, because also, as bad as this is, there's worse on the horizon. So we can't fold up our tents and say, well, we lost that battle. I guess everything's as bad as it's ever going to get. We just have to live now in this horrible reality. Absolutely not. It can get much, 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 much worse. So this is now going to be the good news. Next. All those things we just talked about, all of what Joanna talked about, good news is the press cares about these issues. And when the press cares about something and they need to write stories about it, right, articles, they almost always reach out to groups like PHAN for healthcare. They reach out to other groups for environment, other groups for education, other groups for whatever, and they try to get stories, because they know, like everybody knows, that if they were to write an article with just facts and figures, no one would read it. They would bail at the first paragraph. So they have to grab people. And how do they grab people's eyeballs when it comes to reading something or watching something? You have a story from a person. Where do you get the stories? Reporters cannot find stories on their own. They do, but it would be impossible for them to find all the stories they need all the time. So they reach out to groups like PHAN. They probably reach out to groups like NAMI. And they say, can you connect me with somebody? That's a story. Can you connect me with somebody who is going to XYZ based on what I want to write as a reporter? And PHAN helps them connect with people who are willing to talk to the press. That's one big reason, probably the most important reason why PHAN does story collection. That's in our DNA. We have a fantastic story bank from years and years and years of hard work, and it's mostly because the press will eventually, most often, lift those stories up. We also use them when we talk to legislators about an issue. A common dodge that legislators like to use when we bring facts and figures and white papers to them is, nobody in my district cares about this. Nobody in my district has this problem. I don't hear about it. So I guess that nobody in my district is going to lose access to Pennie, going to lose access to Medicaid. It's not true. They know it's not true, but they say it to kind of, like I just said, dodge the people in the office at the time. And so to get around that, we're always careful to bring story sheets with us, so that we can say, and look, these people in your district care about this, are impacted by this. We need stories. Always, we need to be growing our story bank so that if we have an appointment on November 3rd with I don't know, a rep, doesn't matter, some elected official who's important and can make decisions that impacts our lives. When we have that appointment on November 3rd, we can't start looking even now for stories. We need to have those stories so that we can reach out to the people and say, hey, we're going to see your rep. Can we use your story? Is that okay with you? We'll get permission. It needs to be a conveyor belt, constantly stories coming in. So stories are really one of the things PHAN cares about the most. One of the things PHAN cares about the most. And it's for those two reasons I just listed. Good news is, all the stuff we talked about, all the bad news, the press really, really cares. So let's go to the next slide and see what they've been doing. You've got a story here in the Philadelphia Inquirer. Medicaid cuts could be dangerous for cancer survivors. This woman, Valerie Brown, and then we'll click to the next slide, unfortunately developed cancer in her 40s. She's in her 60s now. She's been taking medicine. The treatment's working, thank goodness. She wants to be with her grandchildren. I think she has 10 grandchildren. How do I know she's 40? How do I know she's 62? How do I know she has 10 grandchildren? Why do I care? I care because I'm a human being. It personalizes the story, and she told her story. I would never know about Valerie Brown if she hadn't told her story, but she did, in enough detail to make it personal to me. I feel like I know Valerie a little bit, and now I care about the issue. I might not have cared about it before. I don't use Medicaid, I might say. So, whatever, turn the page. But here's Valerie, and here's Valerie. In that caption, it tells a little bit about Valerie's story. And in the story, you get more, in the article rather, you get more of Valerie's story. And it becomes something you want to care about now. Let's go to the next one. This is a story that Channel 10 News did. So this is video, not newspaper. This is obviously on the television. Channel 10 News did a story about the government shutdown, the EPTCs, which I call subsidies, at Pennie.com. So the EPTCs, the subsidies, are what the government gives to Pennie.com people to help them pay for their incredibly expensive insurance. And those are now being fought over. And that's part of the reason we're looking at this shutdown. So this is a really excellent piece they did. They tied the shutdown to Pennie.com, to the subsidies, and then to make it something people want to hear about and will remember, they said, called PHAN, do you know anybody who's going to be facing problems because if the EPTCs, the enhanced subsidies, are not extended? And we had in our story bank, we know this woman, Emily. We've known Emily for years and years and years. She only recently, though, developed cancer, and she very bravely told her story, and it is moving. And she did an amazing job. It's not easy to tell your story, so we're grateful to everyone who does. And it's even harder when it's a video issue, you're on the television, right? So, but she did a beautiful job. And maybe if we can send the link out to this so you can see it, that would be great. But this really made the story hit home. If you were only half listening before, you were all the way listening when Emily started talking. Stories make all the difference. Let's look at the next one. This is the headline. PA families risk higher premiums as leaders urge feds to save insurance tax credits. All that is the government, the shutdown is going to talk about partly the shutdown, I think, but mostly that PA families are saying, hey, you can't let our subsidies go away. And click again, advance rather, or go to the next slide. Tony Gonzalez was willing to tell his story. He is another person who's dealing with cancer right now. And when you get these in the PDF, you'll be able to read about this. I just pulled the part of the story, part of the article that's Tony's story. But if you didn't care about it before, you definitely cared about it when you started reading about Tony. And he's another person who's incredibly brave. He actually participated in some in-person events, told his story that way. So, you know, kudos to Tony and Emily and all the people who tell their stories, Valerie. So these are really high drama stories. I don't want to leave the impression that the only good story is a high drama story. People fall into that a lot. One of the things I hear more than anything else when I talk to people about sharing their story is, I don't think I have one. I'm not going to lose my house. If my premiums went up, you know, $1 a month, I'd be okay. Okay. First of all, no. Do not tell me that you will be okay if the premiums go up $1 a month, because that's not the point. The point is they shouldn't go up anything at all. But okay. People tend to downplay their own experience. It could always be worse. I'll tell you that Americans, I don't know of a more resilient people on the planet than American people. We tend to just absorb hit after hit after hit after hit. We tell ourselves that we can do better. We just have to work harder, and other people have it worse, and so and then it becomes normal. We are, I believe but can't prove, we live in I'm going to say the highest stress non-war zone country in the developed world. I don't think there's a question about that. We are under enormous stress all the time, and we've normalized it, and we tend to downplay it. And I think it's a survival mechanism, but we do it. So it's important that people realize that you don't have to have the worst story in the world, because nobody has the worst story in the world. Someone's always going to have it worse. Someone's always going to have it better. You just have to be involved in these programs. Do you use Pennie.com? You've got a story. Do you use Medicaid? You've got a story. And that's going to become even more important, especially about Medicaid coming up. So let's just go ahead, because I've kind of forgotten what slide comes next. We need stories. And that's what I'm saying. We need stories because what we expect to happen is that, and this is more bad news. Okay. But just remember that I'm not telling you the bad news to complain. I'm telling you the bad news because we think it's real, and we can fight back against it. So just hear the bad news for a second. Everything Joanna talked about, the 600,000 people losing coverage, the delays in being able to get your Medicaid renewed, even if you're not a Medicaid expansion person, right? Because the county workers are going to be so overwhelmed with paperwork that even the people who are exempt from Medicaid expansion paperwork, work reporting requirements, the every 6-month renewal. So now we're going to double renewals, right? That's double the paperwork for this population of Medicaid users. All of that congestion is going to affect other people who use Medicaid or do anything at the county, I would imagine. And so the system is going to, it's going to definitely bend, and in parts it will break. And when that happens, and it won't happen this year, and it won't happen in 2026, although SNAP will definitely put a burden on what they can do. Starting in 2027, the burden is going to just keep falling and falling and falling on Medicaid, on the workers, the people who make it work, on the federal level, on the state level, on the county level. And after a little while of that, we expect what Joanna talked about to start rolling out. Not abstractly, not as a number, 110,000, 600,000, not like that, but real people are going to lose their access to health insurance. And they're going to suffer. And they're going to feel very upset, of course. And at that moment, we can expect to hear that Medicaid has always been broken. It's never worked. And so we need to overhaul the system. And at that time, enemies of Medicaid, and I'm not talking about political parties here, I'm talking about people who don't like Medicaid, will use the opportunity to give it back, which is not true because it's never been only a state program. But they'll say the federal government can't do it. Look how upset everyone is. Give it to the states. The states can handle it. And at that moment, we will have lost Medicaid forever, essentially forever. It'll be decades and decades and decades before it comes back because it will have completely ended Medicaid as an entitlement. Now, I know I sound like alarmist here, and I'm not talking about tomorrow. I'm talking about years ahead, couple years, 3 years ahead. And a lot can happen between now and then. But if we stay on this track, we can see it. Just like we saw what happened with HR 1, we can see down the road, a new road now, we can see down it. So what do? We have an incredible gift, as Joanna mentioned. We have over a year before you even have to start reporting work requirements for Medicaid expansion. We have over a year before that burden starts to push and threaten to break the system. We have over a year, okay? The worst thing we can do is say, hey, it's not going to happen for a year. I guess we'll just see what happens. Because every day is that we don't take action is a day lost. So what does action look like? We're not going to call our representatives because there's no bill now for them to worry about. They won't know what we're talking about. They have their ideologies the way they do. We're not going to mess with them. We're going to look to ourselves, and we're going to get stories from ourselves. We need to build an unheard of oral history project devoted to Medicaid. So yes, PHAN has fantastic stories in our story bank. NAMI has amazing stories. I don't know if you guys keep them in a story bank. I don't know about that. I know you're great at collecting them. We as organizations and human beings need to get our stories now. We have over a year. Let's just say a year. We have a year to grab stories. We have 3 million people on Medicaid in Pennsylvania. I'm not kidding when I say this. We have 3 million people on Medicaid in Pennsylvania. We should have 9 million stories because everybody on Medicaid should be able to tell a story. At least one family member of everybody on Medicaid should be able to tell a story. And at least one worker whose paycheck depends on an institution that is funded through Medicaid, let's say a nursing home as an example, but that's not the only one. We should have 3 stories for, one. We have one person on Medicaid that should give us 3 stories. So we have 3 million people on Medicaid. We should have 9 million stories. Obviously, we're not going to get that. But you see the scale I'm talking about. Not hundreds of stories, not thousands of stories. I'm talking literally about millions of stories. We can do it. But we have to start doing it. We're not going to get millions of stories tomorrow. PHAN is not going to get millions. NAMI is not going to get millions by ourselves. We just have to keep asking people and letting them understand the importance of this, of what we're trying to do. Because when the day comes and they tell us that Medicaid has never worked, and everybody is angry because Medicaid is not working for them, and that will be very reasonable. When your Medicaid you're told your Medicaid is turned off because of administrative error number 55, you're not going to be able to think past, oh my God, how do I get my coverage back? My kid, blah, 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 blah. And you'll feel angry. So we need to build these stories now when people are using Medicaid, and it's not perfect. And if people want to vent about, Medicaid could do a lot better on dental, tell it. Say it. I can't find a doctor. Say it. A story is a story. We would love people to focus also a bit on how they are able to get things done from Medicaid. We want those stories now so that when the bad times come, we're able to say, look, we've got, let's just say 9 million stories that show that Medicaid worked before it was broken by HR 1 back in 2025. We have to put it all together. So can you go to the next slide? So this is, I just threw this up here in case, and you'll see it in the PDF, but if you want to see how oral histories work and the impact they have, go and look at the Studs Terkel radio archive. He was a journalist and a historian, and what he did was revolutionary, except it wasn't. People have been talking to each other and sharing stories and trying to collect stories since people could speak. So this has been a human thing. He got famous for doing it in the modern era. And if you go to his archive, you'll be able to poke around and probably be inspired. He just talked to people, as many people as he could talk to. Can you go to the next one? I featured his healthcare here, but he has a bunch of different topics that he talked about and or talked to people, listened to people about. And this is just some of the healthcare interviews he did. So he interviewed a lot of thought leaders, but he also talked to just people, normal people like me. Okay. And so just you can go there and see the impact that what we're talking about with our stories has. So we know they're used in articles in the press. We know they're used at legislators' offices. They're used in humanity, throughout humanity. And this is how serious we have to get about our stories now. And I can guarantee you that Studs Terkel never said to anybody, your story doesn't count. Yes, I just talked last week to a veteran who lost both his legs in World War II. Yes, I just talked to a mother who survived the Depression, but she had to send one of her children away to be adopted by a farm family because she couldn't take care of her anymore. Sorry. But just because you didn't have that happen, your story is still valuable. And we want to hear it. He wasn't in the business of turning people away because their story wasn't dramatic enough. And because of that, we have an amazing collection of a documentation of what it was like to live through things like the Depression, like World War II, and a bunch of other stuff that you can find online about him. Okay, let's go ahead. So this is data, right? Joanna did an amazing job with a ton of data. These are the numbers of what Medicaid looks like in Pennsylvania. Go ahead. Sorry, advance one. These are the stories. And for 9 million people, no, 3 million people on Medicaid, PHAN worked incredibly hard to get like 50 stories. This is not easy work. I don't want to tell you that it's super simple and everybody run out and do it. I'm not telling you that. But it's also not as hard or impossible as we might think it is either. So it's kind of in the middle, which is good. So we put together, this is our most recent one, Faces of Medicaid. Obviously, it's broken out by congressional district. I have 2 right up there. They're okay with us sharing their stories. In fact, Adam's mother said, I will do anything to make sure that Medicaid stays around for my son. So that's how committed she is. And Sean and Colleen are equally committed. So these are 2 examples of stories. So whereas I showed you a chart that said that 3 million people are on Medicaid, you're not going to, yeah, you'll remember 3 million because you're all very smart people and it's not a hard number to remember. But if you were to read these stories, you'd remember these stories longer than you would remember numbers that we give you. I still can't remember how many people are going to lose coverage, 600,000, 700,000. So numbers go in and out, but stories stick with us. So that's our Medicaid storybook. Let's go ahead. Here's data. You saw this slide. Joanna shared this slide. It's data. These are not real people. Those are actors pretending to be these people. Yeah, do you want to go forward? Now what happened here? Click again. Now, I don't know if you're able to click on this, but don't do it yet. But if you were able to click on this, if the link were live, and it was when I wrote the slides, you would see Joanna, this woman's name is Joanna, she calls herself Jo. You would see Jo tell her story in 30 seconds about Pennie.com. And is there a way to make it play, or are we using a PDF? It looks like we're using a PDF, which is unfortunate. So what's going to happen is when you get your follow-up email or whatever, I'll send the link to Nikki and hopefully that can be included in the follow-up. And you'll be able to click on the link and see Jo's story. It's 30 seconds and you'll understand the difference between looking at a slide that says, do you remember any of this data from the previous slide? I don't. but you'll remember what she says after she says it. And you'll tell your friends because she's a human being, not a number on a page. And God bless her, she came and told her story. She used a tool that we have called Soapbox. We didn't create it. We have access to it. And if you click through again, you'll see, I can show you our Soapbox page. So it looks like she made that slide, that story, maybe on her phone, maybe on her iPad. I only have a desktop that I work on and my phone. That's all I have. So I don't know about other stuff that people use. But we have this Soapbox tool that allows people to do what Joe did, which is, this is amazing, look at your phone and tell your story. You don't have to download anything. Nothing junks up your phone, which I love. No passwords to remember, no sign-up sheets that take 10 or 15 minutes to do. None of it. And the rules, not the rules, the guidelines? What is it called when they help you out? Instructions? When the instructions are here, not on this one page, but see where it says up at the top, record your video? You'd click on record your video, and then it would walk you through. I think there's a video you can watch about recording your video. Very user-friendly. So user-friendly that we have like 50 at least people have already jumped in to do this. And so that proves how easy it is. And what if you try it and it's not easy? Well, then you call me. Or you email me and you say, I cannot do this. It wasn't easy at all. And I'll help you out. We'll think of another way to do it. But Soapbox is a great way. If you're comfortable talking to a camera right away, you can do that. Another good thing about this is if you record something and you don't like it. Oh my gosh, my hair, my clothes, whatever. I don't like what I said in the middle. I stammered. I forgot to say that, whatever, any reason. I just don't like it. I just didn't feel it. Don't submit it. And if you do submit something and you don't like it for whatever reason, you call me and we will delete it. So this does not go in stone anywhere. It doesn't get sent to any super collection of videos. You just let me know and we get rid of it. It really couldn't be more user-friendly. Supposing you don't like talking to a camera, that would be like me. I don't want to do this. I would rather tell my story and give you a picture if I have to. You can do that. We can get stories by, NAMI, like I said, I'm talking to the leading storytelling organization, so I feel kind of ridiculous, but we can get stories by talking to people. You can get stories by filling out a form, an email that you can copy and paste. You can share your story by putting that email, we put it into a form. You can do it that way. The most important thing is that you share your story and you let people know that Medicaid works and here's how it's working. And so then it becomes part of the repository of stories, an oral history, and if everything works out and we get the number of stories we need, which is considerable, you never know what can happen. Like I tell people, a documentary filmmaker might find out you've got X number of stories, you've got people talking about Medicaid, or he might decide or she might decide one day that she cares about Medicaid. Well, good luck. Good news, documentary filmmaker. We've got a ton of stories here that with the people's permission, you could look at. Maybe you want to call them. My point in getting on this track is that you don't know what good things can happen if you have the raw materials. But if you don't have the raw materials, no good things will happen. I know that for sure. And we have a little over a year to get what we can get now and which we will never be able to get again. You can't look back. You can, but it's going to be hard when people are stressed without their Medicaid, running into problems, wait times, whatever Joanna described. When people are running into that, it's going to be very hard to say, could you talk a little bit about before when Medicaid worked? No, it's very rare for a person to be able to do that. So we want to grab these now while it's working so that we remember. This could be, let's keep going. I'm as surprised as you are by what slides come next. So we need stories about I looked at it and said access, Medicaid in Pennsylvania, anything, MAUD, Medicaid expansion, traditional Medicaid, it doesn't matter. We want stories about all Medicaid. If you touch Medicaid at all, we want your story. And if you have any Pennie.com stories, we definitely need those as well. Next. Now, I just said any Medicaid stories are good, and I'm standing by it. Any Medicaid stories are good. They're great, and we want them. Medicaid expansion stories are especially important because, as you heard Joanna say, and this is her slide, it's at special risk. But so are waiver programs. PH95 is at special risk. Anything that's optional, like Joanna explained, is at special risk. So we want those stories. We really, really, really want those stories to show that the program worked, is working. Okay, and I keep going. Oh, that's me. So this will be in the follow-up email. You have a question about stories, you're excited about doing stories, you whatever, anything related to stories, just reach out to me. If you're a chapter of NAMI or some group and you want to do a group project where you all get your stories, any great idea you have about stories, we want to hear it. PHAN cannot do it alone. And we also don't pretend to be the only group that knows how to get stories. You, obviously, NAMI, amazing at it. Other groups who don't already collect stories might also be amazing at it. They're going to figure out what works for them. PHAN is not in the business of telling people how to do this. We just want you to do this, and we are in the business of wanting to help you do it. And there's a lot of little details that we need to work out, and talk about. That's not for right now. But right now was about feeling empowered, knowing that you're empowered, simply because you use Medicaid, simply because your loved one touches Medicaid, simply because you're a worker who works in a facility where people are use Medicaid to access it. A program, same thing, that where Medicaid people use your program. We all have stories. It's really hard to find someone who doesn't have a Medicaid story. My first baby was born on Medicaid because and now I'm rushing to explain, right? Because I want you to understand why I was on Medicaid. See, I still have that stigma after decades of it. And knowing that there should be no stigma. My husband was at a company, the insurance lapsed for a month. And during the month, the pregnancy was diagnosed. And because we didn't have the Affordable Care Act in place, it was a pre-existing condition. And so when the insurance came online at his company, guess what wasn't covered? And so the kid was born on Medicaid. And thank God, and yay. I'm thrilled. So I have a Medicaid story. It's old, but I have a Medicaid story. And I guess that's all I have. And please feel free to reach out. Don't be shy. I don't any stories. I'm sorry, any stories. Do you have any stories? I want them now.
I got a lot of stories.
Any questions?
Yeah,
No,
if
I
anyone has
don't
any
see any questions in the
questions.
chat. I'll give everyone a few minutes, like if there are any questions. I don't see anyone. I don't see the little three bubbles dancing, so we might be good. But if anyone has any follow-up questions that you weren't able to think of on the fly, you think of something, 20 minutes from now, feel free to reach out to me directly. Email me. My name is Nikki Wygand. For those of you who don't know me, I know Christine Lederer has been our fearless leader for this project for several months now, and she went to a part-time position here at NAMI Keystone. So my name is Nikki Wygand. For those of you who don't know me, and I'll be taking over Christine's role as far as the advocacy capacity building sessions are concerned. I see we have a question from Donna. I might have to unmute you. Hold on, Donna. Maybe. I don't know if I can unmute you.
Maybe post it in the chat if you can.
Donna, I think I've allowed your mic if you want to come off mute. Maybe they raised their hand by accident. Yeah. Okay. All right. So pending no questions. Oh wait. I gave you the ability to put your mic on. You should be able to now.
If you click the mic icon at the very top of the screen, that's how I turned my mic on. I don't know if it'll work for you.
Oh, I think that might have worked.
Yay!
Yeah, we
Yeah.
gotcha. Go ahead.
Great. My question is, and it might not be a popular one, but I'm just curious if we're not monitoring who is able to get benefits, how do we know that the benefits that our loved ones qualify for are getting to them and being used to help our country or our state if we're not monitoring who's able to apply for those benefits?
So we do monitor who applies for benefits if you're talking about immigration status or citizenship.
Kind of, because I have a lot of immigrants in my family, and they were just were saying that they're legal, but before they got their citizenship and stuff, that they were given all these benefits, and now that they're citizens, they were, because they know I'm involved in this, how they can make sure that the wonderful benefits that America offers are going to be around to help people. And not that we don't want to help people that aren't, but other countries should be forced to take care of their own.
Yeah, I mean, I don't know if I fully understand the question, but what I can say is that when benefits are cut, they're cut for everyone. And we do monitor who applies for benefits. And in terms of immigrants, currently undocumented immigrants are not eligible for anything. So, and that has always been the case. They're in certain circumstances eligible for emergency benefits, but that's it. And we do monitor, everyone is required to prove their citizen or immigration status when they apply for benefits. And when, like I said, when benefits and funding is cut overall, for example, the bill has cut $1 trillion to Medicaid funding across the country. That's not specific to certain groups of people. That's just cuts to the program in general. So that's going to affect everyone, including Americans and anyone who qualifies for these benefits. And so it's just important that we urge our members of Congress to protect what we have and even expand what we have. But really, right now, we're focusing on urging Congress to extend the enhanced tax credits, and our Medicaid advocacy is really focused in the state now to make sure that our administration doesn't make even more cuts to the program that they are essentially going to be forced to make because of the federal cuts. So it's not really our state's fault necessarily. They do have some decision-making power as to what they will decide to cut, but the federal funding is the real root cause. The loss of federal funding is the root cause of any cuts that are going to happen here in Pennsylvania.
And I can answer Ann's question based on what you just said, Joanna, and that is that if you read, and I'll send the link. I hope it's not paywalled by then, but she's worried that the cut to Medicaid is going to mean that they won't cover her drug. Her drug is something like $18,000. Again, here's a number, but it's her drug was incredibly expensive every time she took it. So she's afraid that Medicaid, facing financial pressure, will not cover her drug, and that would be a death sentence for her. So that's how that works. Yes, she is disabled, but she's worried about, will my drug still be covered by a program that's being cut?
Mhm.
So on that note, we actually have another question in the chat from Lance, and Lance asks, how will this impact access to prescription drugs?
So I think, well, if people lose health coverage, they won't be able to afford prescriptions. So if you're uninsured, that means if you rely on prescription drugs, you'll have to pay full costs for the drug if you're uninsured. In terms of Medicaid funding, I guess Medicaid can start to limit the amount of drugs that they offer if they're in a budget crisis. So I don't have a definitive answer on that. Robin, maybe you know more.
Well, that was the right answer. We don't know.
Yeah.
But as for are prescription drugs being targeted specifically? No, not right now, not in HR 1. Is that what you meant, Lance? I will say this, PHAN works really hard on a whole separate issue, which is prescription drug pricing and costs overall. So, sign up for our email list. We don't send out a lot of blasts or whatever contact, but we do send some. At any rate, when you'll see what we're doing on prescription drugs. It could be interesting to you if you care about that issue, which we all should.
I do see Lance is typing.
Yeah, he said yes.
Any other questions? You can always feel free to reach out to us directly.
Absolutely.
Yeah, and I'm going to drop my email here in the chat. And then there were a few questions in the chat about the presentation being sent out. I will be sending out the presentation. So please look for an email from me. Hopefully I can get that out tomorrow. And along with that, the recording from today's call will also be posted to the NAMI Keystone PA YouTube channel. Super easy, Google. You can find us there. All of the other previous advocacy capacity building sessions we've done so far have been on there, as well as the last several months of my public policy call that I host. So please feel free to check that out. And like I said, I'll get this presentation out as soon as possible. And we look forward to welcoming y'all next month back, where we're going to talk about reentry. Yes.
I'm sorry, there's a question about DACA. Do you want to take that?
Oh, okay.
Are the DACA kids still eligible?
So DACA recipients were, for the first time ever, eligible for health coverage through Pennie. That started last November, but they are no longer eligible for health coverage through Pennie as of August. So DACA recipients are not eligible for coverage.
This has been a lot of really bad news, but also I would hope that you'd leave inspired, because there's a lot we can do, a ton we can do. We're very powerful when we work together. And if it just comes down to, it won't just come down to one thing, but if one of the things that we choose to do is to tell stories, that is incredibly powerful. And you can tell your story in an afternoon. That includes all the time it takes you to think about what you want to say and blah 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 blah. Then you can say, I did it. I told my story. You want to get more involved? Get more involved. But really, the storytelling is, I think, a magic key that we would be foolish to ignore. It's hard. You got to get over. You got to get over talking about medical stuff a little bit. You got to get over speaking. You got to get over saying me, I, which people don't like to do. But once you can get over that telling your story is incredibly helpful. I think it's going to be the thing that saves us, frankly. If anything can save us at all, it will be that.
Thank you
So
so
smile.
much for having us.
Yeah, of
Yeah,
course,
thanks very much.
absolutely. Yeah. Thank you everyone, and we'll talk to everyone soon. Have a great day, okay? And enjoy your weekend. Hopefully it's a beautiful one wherever you're at.
Someone said I'm clairvoyant about the future. I'm just old, and girl, I've been here a long time. You can